Sepsis is transmitted to humans by ticks, which acquire the infection from the white-footed mouse and the white-tailed deer. If it's caught in time, you can take a variety of antibiotics, and it will be extremely helpful. It's a worldwide disease, and the United States has the most cases so far. 1/4 of the infected adults and half of infected children were free of symptoms. Yet if they donated blood, they could transmit the infection to others. Likewise, an infected woman could transmute the protozoa to her child in pregnancy or in delivery. The risk of severe and potential fatal infection is highest in newborns, adults older than 50, and anyone with a compromised immunity, including people with cancer, HIV, and those missing a spleen. So they're telling you to check yourself for ticks. If you're someone who does gardening extensively like I do, although I'm in the South, you never know where it's going to pop up. If it's in Europe, in Asia, it could be in Florida. So if you find yourself in that kind of situation, you want to be certain where you have this flu-like symptoms that aren't going away, you want to go to your doctor and you want to ask your doctor about babesiosis. And they're going to say, what? Your doctor should be aware of it. And we talked about doctors being aware. Do we have any callers on the line at the moment? Okay. Doctors being aware. There is a very poignant article in the Tampa Bay Times, I think this past week or a couple of weeks ago, by a Dr. Carl Flatley, who, it turns out, was the partner of my former dentist, who's retired, and he's turned the practice over to a Dr. Obman, who is a superior dentist. And Dr. Flatley's daughter, Erin, died in the emergency room waiting for care. She had been back and forth and back and forth and back and forth. No one recognized that she had sepsis, S-E-P-S-I-S. I'm going to give you the website to go to. And that is www.sepsis, S-E-P-S-I-S, alliance.org. Why do you want to know about this? Because hundreds of thousands of people die from it in the United States every year. In 2009, 1.6 million people were admitted to U.S. hospitals for sepsis. Often they're being treated for underlying conditions such as cancer, pneumonia, or other conditions like severe flus that suppress the immune system. Here's a scary thing. Most doctors and nurses don't even know what it is, don't recognize it. So they're giving you advice here. If your doctor can't seem to pinpoint what's going on, if it goes too far, it kills you or leaves you crippled. It kills more Americans each year than prostate cancer, breast cancer, and lung cancer combined. It can be stemmed by making sure your doctor scrubs his hands and arms, the nurse scrubs her hands and arms, wears gloves before they examine you in the hospital or in the office. And this doctor's daughter died before he had surgery. And when he recognized some of the symptoms, which are usually flu-like, and usually after surgery, the hospital wanted to whisk him out the door, and he said, I ain't going nowhere. I am right here. I am going to stay here because I believe I have sepsis. And if you remember my name, my daughter died of it in your sister hospital, and I am not going anywhere. So early IV fluids, vasopressor drugs to increase blood pressure, and most importantly, a series of antibiotics. And here's a really scary thing. Not only do doctors and nurses not acknowledge it, most U.S. hospitals have no sepsis protocol. And as a dental surgeon, this doctor is very familiar with hospital care and hospital protocol. When they do a code blue, that's because someone's in trouble and you need to send the crash cart. He's saying there should be a code sepsis, because the faster you get on top of it, the faster your successful survival will be. So we are dealing with the cycling of diseases, things that haven't been recognized, things that are now getting recognized. You, as an informed patient, must say to your doctor, could I have sepsis? If the doctor blows it off, say, screw it, I want a test, I want a blood test for sepsis. Because not all doctors are good. Not all of them pass their own boards because some of them paid others to take it. Big secret out there. It was featured on 60 Minutes in the neurological field this past Sunday, where a lot of neurologists get together, study certain portions of the test, pass along the information, and then they can pass their tests. They're not qualified. You wonder how come you go to so many doctors and they don't know what the problem is. They're not qualified by and large. Or something is so remote that no one's ever heard of it. Sepsis, in practice, is actually well known. 40% of doctors coming to visit you did not wash their hands. That is a national statistic in the United States. So they may have been handling a cancer patient, HIV, someone with a bad cold, pneumonia. They come into your room, they start examining you, touching you. You are now going to be infected. So it's important. It's called sepsisalliance.org. And it's important that you know about it. It can save your life or the lives of others. And Dr. Flatley said he felt that his daughter was watching out for him and reminded him of the symptoms of not feeling great, feeling weaker and weaker, feeling like you've got some kind of flu and muscle infection, and that's it. If you go on this website, it'll give you further information, but that is a thing that can be, and is often not, prevented because of careless medical procedures by your doctor, by technicians, by nurses. If you have somebody coming to take your blood, ask them to wash their hands and put on latex gloves. If they say, oh, I just did a little while ago, say, wash them now before you touch me. That is your right. You're in the hospital. You're the patient. You must demand good care. So this babesiosis, Lyme disease, if you're out walking anywhere, even in your own yard, you don't know what's walked through your yard. We have coyotes down here. There are coyotes in all 50 states, by the way. Coyotes carry ticks. Foxes here, raccoons, possums, they all carry ticks. You don't know where they've been. You don't know what's nipped at them, what they have nipped at. You've got no clue. So you have to look out for yourself. And our prayers are going out to Tom, and we hope and pray that he gets the proper care. We just sent them to a doctor I know, and hopefully things will get better for him and all of you who need special medical and spiritual blessings. I'm Linda Bennett, Metaphysically Speaking. We're coming right back.